we'll wait for you when you get your wonderful best health news that you could possibly get, and that is that you'll be cancer-free. You'll come back and the show will be here waiting for you. So I took Bill's advice. I went and rested. I went and got some great advice. And yes, I definitely had breast cancer. I was diagnosed in both sides, left and right, 2 different kinds of cancers. And understand, I have no history of this in my family, so it came completely out of the blue for me. And again, I had never missed a mammogram. So if there's any message here, it's like, ladies, don't miss those mammograms, because you know what? Not even the mammogram picks up everything, but at least if you're going to your doctors, you have a much better chance of having these folks pick things up. I discovered a wonderful medical community out there. I thought I knew, since I have doctors on this show all the time. But my first person who I was referred to is Dr. Ronald Bauer, who is sitting to my right. He was my surgeon because I decided that we would go ahead and have surgery, of course, to remove it. And then next to Dr. Bauer is my plastic surgeon, my reconstruction surgeon, Dr. David Rigan from the Center of Plastic Surgery. So thank you for coming in this morning. I get these guys out of operating rooms and seeing other patients this morning, and here we are, gentlemen, at kind of the end of the road. It's hard to believe, but Dr. Bauer, what did you find with me?
Well, in your case, there was a lump in the right breast that you had found, and you went on to have your mammogram, which showed calcifications in the left breast, which can be associated with a breast cancer 15 to 30% of the time. And you had your biopsy on the left breast, and that was also a different type of cancer. So your right breast had invasive duct, your left breast had invasive lobular. And that's the real key, is to pick up these things before you can actually feel them. And that's the real key with breast cancer, is early diagnosis. And you made an important point. You said you were the first one in your family, and probably 90% of the women I see in the office have no family history of breast cancer and are diagnosed with a breast cancer. So that's why, even though you have no family history, it's real important to go every year for your mammogram, starting at baseline at age 35 and then yearly starting at age 40. If you have a strong family history, then those numbers should be moved even earlier.
Is it odd to have 2 different kinds of cancer?
It's a little bit uncommon, yes. Invasive duct accounts for 80% of all the breast cancer, so that's by and large the most common type. Lobular only counts for about 8 to 10%. So you had the most common and the second most common. But in general, only 5% of women have bilateral breast cancer, so that's not real common to begin with.
Now, we had to decide what to do. And I could have, I suppose, had lumpectomies, but I didn't want to do that because I thought, look, if it's in both sides, why go through this again, perhaps down the road?
Sure.
Let's think about a bilateral mastectomy.
No, you're exactly right. Your cancers were small enough that you could have pretty much had any option you wanted. You could have had bilateral lumpectomies with checking the lymph nodes and radiation, or bilateral mastectomies, either with or without reconstruction. So, I mean, yours were caught very early, so you had those options. Some women come in with much larger tumors, and they really don't have that option. They haven't been checking themselves, they haven't been going for mammograms, and they're pretty much committed to a mastectomy.
Yeah, now I have to tell you, the last time I saw both these doctors was on the way to the operating room at Millard Fillmore Suburban. By the way, great over there. They took excellent care of me. It ended up being a very positive experience. I mean, I met wonderful people over there, great caregivers. And then Dr. Rigan, you stepped in because you were going to be handling the reconstruction, which you did. Yeah, so tell me about that.
Well, the reconstructive part really occurs, generally obviously after the mastectomy. Sometimes it's really up to the patient whether the patient wants reconstruction or not. And that's always the first question that they get to after they've dealt with the initial diagnosis is, well, if I'm going to have a mastectomy, what's my next step? Do I do a reconstruction immediately, or do I put this all off until later? I think that it's a difficult time. It's a big decision. There are lots of decisions to be made. And I think the important thing about reconstruction is to remember that you don't burn a bridge if you decide you're not going to do it. Some people are just overwhelmed by everything, and they say, you know what, this is one extra thing I don't want to think about right now. Both types of reconstruction, either using your own tissue or using implants, can be done at any time, either immediately or afterwards.
We should let people know, too, that, Dr. Rigan, you don't do this anymore as a rule, but other doctors in your practice do.
That's correct.
Yeah.
Right.
But for a lot of women, the way to go about reconstruction is to have expanders put in.
Yes. Well, if you choose, there's two, like I said, there's two basic types of reconstruction. You can either use your own tissue or you can decide to use implants. If you use implants, depending on the type of mastectomy, if there's not enough tissue, if it's going to be too tight to do the reconstruction, then the first step would be a tissue expander. I brought an example of a tissue expander. Basically, it's just a deflated balloon, and it's got, I don't know if you can see this, it's got a metal port in it that you can find with a magnet. And then through the skin, you can gradually inflate it. It stretches the skin just like in pregnancy, and you get to the point where it will then accommodate a permanent implant.
Now, you all remember my figure. I didn't need to go that route. I went right to the implant, and we have a couple of those samples too, right?
Yes. Well, these are two examples of implants. They're basically the same. They're gel-filled, although there are saline-filled implants these days. This is an example of a textured implant, and this is a smooth implant.
What's the difference? Why?
Well, there are one of the complications with implants long-term down the road is that the scar around the implant can shrink, and it can either move the implant or it can make it tight or sometimes painful. There are some people that believe that the texturing will decrease that incidence.
Which did I get?
You have smooth implants.
Okay. I'll keep an eye on that. How long will these last?
Well, the implant manufacturers warranty them for about 10 years, although there's no, I mean, we see patients routinely that have had implants for 20 or even 30 years. There's no expiration date on the implant.
Well, I'll tell you, like you say, when you're going through something like this, you do have a lot of options. You have a lot of things that you're thinking about. You're thinking about recovering. You're thinking about what am I going to do? I want to come out of this hole. It's wonderful that we have so many terrific people who can really take you down that road and give you those options so you do come out of this feeling healthy and well, and you feel more like the self that you went in with. But I'm sure you have questions out there, and that's okay, because we're going to hang on to these doctors when we come back. We're going to take a quick break. They're going to answer your questions, okay? So give us a call at 644-9840, and I'll answer them too. And again, it's really nice to be back with my doctors. So stay right there.